Hiccups are involuntary contractions of the diaphragm muscle, causing sudden intake of breath. Various factors, such as rapid eating, stress, or certain medical conditions, can trigger hiccups. Carbogen therapy, involving the inhalation of carbon dioxide, is a scientifically recognized method for hiccup relief. Increased carbon dioxide levels in the blood help to regulate the diaphragm and cease the involuntary contractions. Carbogen therapy involves increasing the concentration of carbon dioxide in inhaled air. The technique requires covering the mouth and nose with a clean plastic bag. Breathing normally inside the bag for 10-15 minutes elevates blood CO2 levels. Elevated blood CO2 levels can effectively stop the hiccup reflex. Carbogen therapy provides a method to regulate involuntary reflexes through controlled respiration.